The year 2025 began with bold commitments from the federal government, over 1.3 trillion naira allocated to the health sector, the highest in recent years. Yet, the realities on ground reveals a system still battling the familiar burden of personnel shortages. Nigeria reportedly lost thousands of doctors, nurses and pharmacists to the UK, Canada, the Middle East and the Caribbean, as brain drain persisted despite intense recruitment drive and welfare promises. Strikes by some health worker unions earlier in the year further disrupted service delivery in several states.
Overall, the production capacity is still very low, and it will still take Nigeria a very long time to produce the required healthcare workers that are really required in the country.
We had a period where all the primary healthcare centers in FCT were shut down for almost 4 months. Over 40 years, nurses have not been on strike, so they went on strike this year.
Another defining feature of the 2025 was the soaring cost of medications. Essential drugs like insulin, malaria treatment, antihypertensives, and antibiotics became difficult for low-income households to afford. Despite efforts by the National Health Insurance Authority to expand coverage, millions still struggled to access quality drugs.
I have spent over 17 million naira for my first course of treatment. In a case where you are spending over 17 million naira and the government and the CHF assists that you're getting is 1 million naira, where is the significance of that?
This year, I was hospitalized this year twice, and I would personally say that the prices of drugs have increased.
You want to do some tests, you have to run through your NHIS, your HMO, you have to wait endlessly for calls for your HMO to approve. And sometimes when the feedback comes, they say your NHIS doesn't cover this.
There were, however, notable gains recorded in the course of the year. The National Primary Healthcare Development Agency said that 901 primary healthcare centers across various states were renovated, while immunization coverage improved with the rollout of digital tracking tools. Nigeria also intensified its surveillance and response to cholera, Lassa fever, and meningitis during the year. The introduction of the malaria vaccine in selected pilot states like Kebbi and Bayelsa marked a positive milestone. Collaborations with WHO, UNICEF, and the Global Fund supported routine immunization, HIV treatment access, and maternal health interventions.
Naira-wise, we have seen a substantial increase, almost 60% increase. Looking around not only the budget, but also looking around the basic healthcare provision fund, which is a catalytic fund, looking around the primary healthcare, the health insurance, the pandemic response, and quite a lot more. So there's a lot of money coming in.
2025 was a year of big health promises, but also a tough realities. Government reforms, vaccination drives, and new strategies showed intent, yet capacity gaps and resource shortages remained across many states. As Nigeria prepares for 2026, the challenge is turning policy commitments into improvements that citizens can actually feel. In Abuja, for News Central, Sumaya Abubakar.